Let's turn now to a company that needs no introduction, of course, but may need some introduction and clarification when it comes to the health space, and that's Microsoft. And joining us now is Tom Lawry, who's National Director of AI for Microsoft, with a particular emphasis on how that can work in the area of health and medicine. So, Tom, first of all, everyone knows Microsoft is got a hand in just about everything, but tell us a little bit of how it is got fingers in the medical and health pie.
Well, first of all, Brian, great question, and thanks for having me. So at Microsoft, we serve all major segments, but of all of the segments, when it comes to business verticals, healthcare is probably one of our most important, and it's one where we have a very large presence. Microsoft's technology, be it data and AI, be it collaboration, is universally used by healthcare in general. Very specifically, though, we have things such as, as everyone moves to the cloud, we've got a very specific health and medical grade cloud that we offer to providers, payer organizations, and life science that allows them to have the benefit of digital transformation, but it's in keeping with all of the things like security and compliance that are very specific to health and medicine. Beyond that, we work with a lot of major partners that you would know of that are the major players for things like electronic medical records, diagnostic imaging. And when you pop the hood on what they're doing on things like artificial intelligence, what's underneath their products many times are the Microsoft components that are driving that intelligence.
So I think a lot of people in the health and medical space are going to say, okay, I'm being pulled a couple ways. There's a lot of new players that are coming at me or my organization to say, we've got the technology that you need, and we are born and bred of this industry. Then you've got Microsoft coming in saying, we have a significant track record in this industry, but clearly we're not a health technology company per se.
Right.
How can, regardless of the players involved, how can a healthcare provider or other practitioner most cleanly make the decision where the right connection is for them in what they want to accomplish for their patients? Whose horse to get on?
The simple answer is Microsoft is not per se a first party provider of health and medical solutions. We enable many of the largest players in the market to be better at everything from collaboration to making better use of all of the data that's churning through their systems or being generated by it, or using it to make things like predictive capabilities even better for clinical decision support. Beyond that, when it comes to some of the digital first companies that are coming into the market, again, part of our model is they've got to ride on someone's cloud. They've got to be using certain components that drive the ability to create algorithms and do so in a way that's not only consistent with things like compliance, but also are things that are focused on how to make sure that those things are being applied equally across all populations to do things like reduce bias. So we really have a place in the market that spans everything you just said. And it's more about looking at how we adapt our core technologies and optimize them for healthcare that allows, whether it's a major medical organization or some type of medical device company, serving them to be better at what they do.
Let's turn now to your core expertise, which is AI. So thank you for that framing, just so we know where you're coming from the Microsoft point of view. So let's talk now about artificial intelligence and how it is and isn't working in terms of the new breeds of services and digitization of medicine that's going on right now. There has been an awful lot of hype around how it's going to radically transform medicine and do so very quickly. And there's also been some black eyes suffered by some companies I won't mention who perhaps overpromised and rather radically underdelivered on AI's ability to do things that medicine has been unable to do so far. Where do you think AI will most imminently have real concrete effects in the year or two ahead that our audience should know about?
Well, first of all, I'm glad you brought up the fact that artificial intelligence, particularly in health and medicine the last few years, has been what I call a shiny object. It's amazing the claims, the aspirations people have made, and yet we know anyone who's in this space knows we're all early in the journey. And so when you're early in the journey, the things we're doing now we'll probably chuckle at even 2 years from now when it comes to how we are evolving. So you look at things like, different components of AI that are reaching human parity, vision, speech, knowledge extraction. These are all things now that are commercial grade that can be applied to innovating the way things work today. Even a few years ago, 5 or 6 years ago, those things could be done, in an experimental lab, but they really weren't commercial grade. They are now. So what we're seeing when it comes to benefit in the here and now is everything from a lot of operational efficiencies, my ability to do everything from predict my census if I'm a hospital, my ability to aid physicians and nurses and others in making clinical decisions, support decisions to get better at something where the output is better patient care. I'd finally bring it back to, if we just look at the last year with COVID. When COVID first hit, we have an industrial strength health bot. We quickly pivoted that to create a coronavirus or COVID bot. We put it out free for anyone to use. CDC picked it up. Basically, it allowed anyone to use this bot to go through a self triage to see where they were and what they should do. That was used by tens of millions of people. It automated something everyone needed. You can only imagine if those people were calling some phone line and trying to get to a human. So we've got lots of examples. It's only going to get better and deeper when it comes to predictive capabilities to help health and medicine.
Would you say that right now, our audience should view AI as being able, in its current state, pretty young, as being able to rapidly and massively add efficiency to existing things that medicine does? Or is it already delivering the ability to do things that previous human medicine could not do?
The first way I'd answer it is the technical capabilities are already there, they're strong, and they're capable of driving transformation at scale. Last year, I wrote a book on AI and health, but in that book is the introduction of what I call the emergence of intelligent health systems. There's traditional healthcare that operates the way it does. Going forward, to your point, an intelligent health system is an entity. It could be a hospital, it could be a public health department that leverages data and AI to create strategic advantages through the efficient provision of services. But operative here is doing so across all touch points, channels, and experiences. So one quick factoid, Change Healthcare and Harris Polling Organization last year did a study of health consumers. The most interesting part of that study, health consumers reported that finding, accessing, and paying for healthcare requires so much work that half of them avoid seeking care altogether. So if we look at that alone of saying, how do we use intelligent services, just as many other industries outside of healthcare are already doing, to make that whole experience better, not just the provision of medicine, but make that whole experience better.
That's interesting. You're mentioning something that I've heard echoes of in different wording from a number of other smart people who said efficient healthcare isn't just efficient in terms of its gains, in terms of maybe lowering cost or higher patient throughput in a given system. It's better healthcare, isn't it?
Absolutely. This is where understanding what AI is good at and what it's not good at, and how you bring intelligence in behind humans, knowledge workers, that's the key to driving transformation at scale. And that's where it's everything from, there's one study that showed we have a huge problem in America and across the world with clinician burnout. There's one study that shows AI can eliminate up to 30% of what a clinician does. Most of that is that repetitive work activity that doesn't drive value when it comes to their capabilities. So imagine if we could use AI alone to reduce repetitive activities of doctors and nurses and give them back that much time to either look you in the eye as a patient, do more research, or actually get home for dinner more often than they otherwise do.
That's the thing, the echo that I think we see over and over. And I think many members of our audience either know that pain or they've seen this messaging, which is obviously responding to that pain in a very large industry, that there is a need to put the human physician and their uniquely human skills in the places where they make the most sense and get them out of an increasingly complex system that just begs for computation and a basic limited sense of intelligence. I know we're a long way from true artificial intelligence, but a basic intelligent machine to handle a lot of things that need excessively good accuracy, no lapse in focus, utter repeatability. Those are the hallmarks we already have available to us in AI, right?
Yeah, it's a great point. And think about this. So AI is really great at certain things, better than humans. Things like recognizing patterns among massive amounts of data. So it can do a great job of looking for patterns we're not seeing, predicting things we care about. But at the same time, when you look at what AI doesn't do now, and in my view, won't do anytime soon, that's critically important, that it's unique to humans. It's wisdom, it's reasoning, it's judgment. It's all these things that as a human, as a physician, as a nurse, you learn through your graduate medical education, your training, all of the years of experience. It's those things that really we need to take advantage of when it comes to the humans. And we do that by aiding them with what AI does a really great job at. But it's those two things. I often hear people talking about, well, AI is going to put radiologists out of business. Anytime I hear that, it makes me think, this person doesn't understand what AI is great at and what we have a critical need for when it comes to those human clinicians.
I hope this gives our audience a little better idea, and I think it does, of how to understand where AI fits now and in the foreseeable future. I know, as you know better than any of us, there's a highly unforeseeable future. It still lies out there that's just absolutely tantalizing where this can go. But we get there one step at a time, and certainly as we in this room try to figure that out and understand how to take advantage of it, I think this gives us a much better perspective in the general contours of our discussion today. Tom Lawry is National Director of AI for Microsoft. Thank you, Tom.
Thanks, Brian.